Hello, my name is Lee. I'm a student nurse at the University of Stirling, specialising in the adult field of nursing. I would like to welcome you to my channel and welcome you to this video series that I'm going to be doing over the next few months. In this series, I'm going to be talking about Aspergers and nursing. And I'm going to be asking this question: can a person who has Asperger's or autism go on to become to study it as a nurse? So we're going to start off this video by defining what autism and Asperger's is, and then I'm going to move on to talk about what Asperger's and autism looks like in actual practice, so being out in the clinical areas or being in the university, or depending wherever you are as a nurse at the time. So we're going to move on and talk about the first part in just a moment. Before I go any further, I just want to introduce you to who I am and just say a wee bit about me. Just by looking at me, you probably would just think I'm just an ordinary, bog standard human being, person who's studying to become a nurse. That is all true, but what makes me unique is I have Asperger's myself. So this video is coming from an inside perspective, and I'm going to be talking about from a lot of personal experiences as a student nurse, and giving my reasons why I believe people with Asperger's or autism can become a nurse. I'm going to be talking about how that can be, and how the universities and your placements can support you to become the best nurse that you can be. So stay tuned over the series as I will explore various other topics. So moving on to the first part of this video. So in this part I'm going to be talking about Asperger's and autism, what it is, how it affects the individual's life, and some of the characteristics associated with the conditions. So starting off with autism. Autism, it is a spectrum condition, so it means it does vary, so you'll have different levels of severity, and again this is individual to the person. So, and I'm not going to go into this in great detail as this is something entirely different, and I might do this in a much later video. So, understanding autism. So autism often has much more complex needs. So they're often more sort of developmental problems, sort of cognitive development, and sort of your speech and language as well, and your social skills as well. And autism can also have associated learning disabilities and mental health issues as well. Asperger's is also on the autistic spectrum. However, Asperger's is often regarded as a milder form of autism. That meaning there isn't as many of the complex needs that a person with autism might have. And it's important to understand this in this detail. So what are some of the key differences? Well, it's very hard to sort of say the difference between the two. So, and it's very individual. You could have Asperger's but have very complex needs. However, again, you could have autism and have very mild, very little input needed. But again, it's something important to understand. So, an easy way to understand the two is Asperger's is often more associated with your language and your language development, and also some of your social development as well, compared to autism where there's a lot more complex needs in there as well. So just to add on a wee note, is people with Asperger's are also affected by other learning disabilities and can also be affected by mental health issues as well. It is important to note that as well. So kind of going into the next part, talking a bit about how it affects a person's life. It's very individual, and it takes quite a lot of understanding and a lot of appreciation, and you have to really spend time with a person in order to truly understand how it influences their lives. So from my part of things, I do have some areas of language issues. So when I am talking, I can overcomplicate what I'm saying, and when I'm trying to say something, though I'm thinking of what I'm trying to say in my head, what I mean in my head, what I'm actually saying isn't what I'm meaning, and it can be a little bit confusing for other people So sometimes I do need to take a bit more time to explain something, get my point across. I do have some areas of some sort of being socially. I don't always want to be social at times. So when I'm at home, there are times when I just say to my wife, I just need my own space. I don't know how long I need, but I just need to have my own personal space where I can control the environment, where I can control what the noise levels are, and also be just relaxed in that environment for a period of time, just to unwind and do what I need to do just to relax. So, and that's just individual to me. And many people who are on the spectrum will have similar things, that they do need to have time on their own, and it can be very important just to sort of unwind. So there are a couple of other areas I really want to touch on, and that is when a person is affected by sensory issues. So moving on, I'm going to quickly talk about sensory sensitivity. So we all know that we have 5 senses, so your sight, sound, smell, touch and taste. A person with Asperger's or autism can have what's known as either hypersensitivity, which is oversensitivity to certain sounds, for example, or hyposensitivity or undersensitivity to certain things, and this can affect all 5 areas. So understanding these things is very important. So being overly sensitive, it can mean that it's too overwhelming, it can make you feel like going like that in every situation almost. Or hyposensitivity, where when you're doing certain things you can just stand there and just be like, this is fine, and you can appear, it can be quite it can almost seem quite unaware of the certain things. So one of the key areas that I'm going to quickly touch upon is sound, as sound sensitivity is often one of the areas affected in Asperger's and autism. And personally, this area does affect me in particular when I'm out in public areas. So talking about, to understand sensitivity, I'm going to use sound as a good example, as this is probably the one which affects most people in different ways. So undersensitivity is when a person may not hear certain sounds, and that might just be in one ear, so it can almost feel like they've got partial hearing or almost be deaf in that ear. They just may not hear that, but also they may not acknowledge particular sounds, and that's just something to sort of understand, is when a certain sound is made, so like a bang, you might not hear the bang and you might not understand what's happened, for example, and that's just a very vague example. And then you've got hypersensitivity or oversensitivity, and this is probably very self-explanatory. So noise can be probably the one that affects people the most. So sort of very loud noise, particularly banging noise, can affect me really badly, and this is something which makes me feel quite anxious. Some people have this very unique ability where they can hear conversations from some distance away, and they can hear what's going on. They've got good hearing for that. And some people have an inability to actually cut out sounds, so very notably background noise, and this can lead to difficulties concentrating. This area does affect me quite personally. So when I'm studying in the library or at home, I've got to be in an environment where it's quiet. So often in the silent study where there's no background noise, because this can be quite distracting, and it makes it much harder for me to concentrate when I'm doing my work. So I like a nice quiet environment, somewhere where I can focus on what I'm doing. And this is just unique to me. Again, there's a lot more to this, and it's something that's really important to understand. And I'll touch upon other areas of sensory sensitivity, possibly at a later. So moving on to part 2 of this video, and I'm going to be talking about what the clinical practice actually looks like for a person who has Asperger's. So again, this is very much an individual perspective from my point of view, and if there's other people who have Asperger's who are nurses or healthcare professionals, they're going to have a completely different experience from me. So this is very much my experience in clinical practice, and I have to say, being out in clinical practice has been quite positive most of the time, and I've not had any major issues at all. I have had some good constructive feedback, and I've taken that on board, and I'm adapting it to, and I'm learning from that experience, and I'm adapting how my practice goes on. And really, I want to point out is, in order to become a nurse, or when you become a nurse especially, is you have to become a reflective practitioner. It's part of the requirements that we have to do, and you have to be able to reflect on your own practice and continuously develop. And this is something which is a career-long thing. So, and that's something that I'm constantly doing with my condition, is learning how to work with my Asperger's, understand how this affects me as an individual in the clinical environment. So, being in the clinical environment, hospital environment, so how does it affect me? So, I'm currently out on practice placement at the moment on a ward. I'm not going to say where I am, what ward I'm on. This is really just to protect the staff and the patients on the ward, so no information gets passed on about them, and I'm not going to be talking about anything about my patients. So, talking about my experience on the ward so far, personally, I've not had any major issues in terms of sort of sound sensitivity or any other sensory issues, or any major issues with unexpected changes. And you're probably thinking, how is that? Well, I want to say is because a few years ago I said I wanted to become a nurse. I chose this career pathway. This is where I wanted to go. I really feel when I chose to become a nurse, I knew that there would be things that would affect me. However, but because I've chosen to be in that environment, I'm expected unexpected changes. I'm expecting there to be sights, smells, and other things that really sort of I'm not comfortable with. But I'm expecting all that, so I'm expecting the unexpected, and that to me helps reduce the anxiety, the stress of that environment quite considerably, to be honest, and that's something that is quite reassuring. So my advice to anyone who has the condition and goes out in clinical practice, don't worry about it. If you are having sensory issues, be encouraged, talk to your mentors about it, even if you feel that you can't approach them. Find somebody you can approach. That might just have to be somebody at your university, or a friend, or whoever you trust the most, and talk about how you can be in that environment, how you can sort of work through some of these challenges. So, in practice, one of the areas that I do struggle with is my verbal communication. I have a tendency to overcomplicate things, and I could talk for my country, really. So, and I can overcomplicate certain things when I'm trying to say something to maybe my mentor, and I have been told, Lee, just draw it back a little bit. You're overcomplicating it. You just need to keep it simple, short and sharp and to the point. And it's a learning process. It's learning how to do this. And the same goes with the clinical notes. I could write a story of what's happened for that patient. But again, it's learning how to use my written communication as very much as my verbal communication. So, and being in clinical practice it's a really good place to sort of learn all this. And I have good support from the clinical staff, and they're very approachable if I've got a question about something. And they've been quite accommodating, which has been really good as well. So I really kind of just want to talk a bit about some more of the sensory issues and the unexpected changes. When you're out on the ward, you're always going to be having unexpected changes. So you're going to have patients who are being admitted discharges, and they can be quite sudden, and we need to move them on. A patient could deteriorate suddenly, and you have to quickly adapt to that. You could have 6 different things going on at once, and it can be quite difficult to sort of manage all that. But this is where learning how to sort of spread out your tasks, sort of prioritise the ones you need to do, and work through these challenges and work through these things. Say, this is what has got to be done at this time, I need to do these particular tasks. What is probably the most minor of these tasks, and can I put it off till the end of the day, or do I need to do this now? And it's prioritising your workload, and it's learning how to do that. And this goes for any member of staff, and learning how to sort of prioritise that is quite key. And I probably would say, in terms of the sensory issues, I'm not overly sensitive to certain sounds in the environment, because as I said before, I've chosen to be there. I'm expecting there to be shouting, I'm expecting the call bells to be going off, I'm expecting the family members to be disgruntled, I'm expecting to have sounds which are quite, could be quite overwhelming. So and it's learning to get used to these things. I think the more time you spend in an area, the more you get used to that environment and the more you become accustomed to what is going on. And I think it just takes time to sort of work through that. And the same goes for unexpected changes. I'm still waiting for the day when a patient is going to have a cardiac arrest and I have to learn how to respond to that. To me, I'm quite anxious about that. Nobody ever hopes that that's going to happen throughout their career, but in reality this can and will happen at some point. And it's being ready to respond to that situation and know what you need to do in that situation. And again, the same goes for patients passing away. And it's learning how to work through that. And again, I'm still yet to experience that, and that's going to be quite an emotional, quite an experience for me. But it's something that I'm expecting to happen at some point, and it's a learning process how I will work through these issues and how I can sort of overcome them. And this just goes for anyone. I think for me, my Asperger just doesn't really affect that, which is quite good in a way, because I'm not overly worried about it. I am aware of it, but I don't think I'll be too sensitive in that situation. So I just want to sort of finish this second part, and just quickly talk about my experience so far. As I've said, overall I've had a really good experience on both of my placements, and coming up to the end of my first year now, and my placements have really set me up and really taught me a lot about how nursing works. So I've felt really positive about my experience, and I've learned a lot. There's a lot I've learned about myself and how my condition is affected in practice, and there's a lot of reflection that I can do to sort of say these are the areas which I may be affected by. There are still some sounds that I really don't like, and I'm just going to have to work through it and learn how to sort of say how can I work through these noises, how can I work through these barriers, and how can I become less stressed